What's hot in health? Share your thoughts. Join Local 12's Liz Bonis every Wednesday at noon. The team at TriHealth will be there for your concerns. Health Talk Live with Liz, sponsored by TriHealth, every Wednesday at noon on Local 12 News. Health Talk Live with Liz, sponsored by TriHealth.
Good afternoon once again in Health Talk Live today. A hidden danger with COVID-19 and the brain. Researchers in JAMA Neurology found the stroke rate is 7 times higher in those who show up in the emergency room with the coronavirus than in those who have other viruses, such as the seasonal flu. Here's TriHealth emergency medicine specialist Dr. Chris Zammit.
I think really the underlying problem we're seeing with patients who are particularly sick from COVID-19 is an increased risk for clots to form. And those clots can be either in the veins or in the arteries. So when we're taking care of patients in the hospital, we're putting patients on blood thinners. Actually, we're putting them on a little higher dose of preventative blood thinners that we use in other patients when somebody's really sick to help prevent the clots from forming in the veins, and particularly when it goes in the veins, those clots can go into the lungs. But then also, clots can still form on the arterial side, which is delivering blood to different parts of the body. And included in that is stroke. So
would the symptoms then, which is really what we always want to know about stroke, we always hear the FAST acronym, you know, that if you can't speak or you can't lift your arms or you're having trouble even, you know, sort of articulating what you want to say,
right,
would the symptoms be similar no matter what is causing the stroke?
Correct, yeah. Whether you have COVID-19 or not, if you're having any stroke-related symptoms, it's the same. It's the same. That's right.
So what is a stroke?
Right. So, in the simplest term, a stroke is a sudden issue with a blood vessel inside of the brain, and that issue could either be a blockage of blood flow to a part of the brain, causing a lack of blood flow to part of the brain, or one of the blood vessels in the brain has broken, and there's now bleeding into or around the brain.
And I know your team specifically has done some very interesting research that people who actually have strokes are not necessarily showing up to the emergency room, maybe for fear of catching COVID, maybe for just not acknowledging that I could possibly be having a stroke. What did you find out about that?
That's true, yes. Yeah. What we found was that for patients who presented to the hospital with stroke-like symptoms during the COVID period, and we had that research done both here at Good Samaritan Hospital as well as at several other hospitals not in the Cincinnati area. We compared that to the same period 1 year prior. Patients were presenting 2 hours later after their stroke symptoms.
Which matters why?
Huge, huge. So what we already know is that if you delay treatment for a stroke by just 15 minutes, you have a reduced likelihood of being able to walk again, to go home again, to survive. And when we treat you for your stroke, you're more likely to bleed into your brain as a consequence of it.
Boy, important stuff. We'd love to know what you're talking about. You can either shoot me an email, or I'd love to hear from you on Twitter or Facebook. @LBonus1 is the Twitter address. Coming up, we